Welcome back. We're continuing the value analysis program, and we're going to start talking about infrastructure. And the bad news about infrastructure is this: it tends to be the most boring part of the entire program. So I'm giving you a fair warning right up front. Infrastructure is difficult, and it's not difficult because it's difficult to put together or to understand. It's difficult because it tends to be very boring. It's the mundane part of a program. And unfortunately, because it's the mundane part, it's the part that a lot of people don't give a lot of attention to. Unfortunately, without proper infrastructure in place, your program is going to suffer as a result of it. So, even though it's a little boring, please bear with me because this is what keeps your program alive for the long term. So you have to pay attention to it. Infrastructure is a key piece of any program. And so as we're going forward, I'm going to be talking about this. I'll try to liven it up a little bit. I know I tend to be kind of a low voice, and adding that on top of infrastructure discussion probably isn't helping me to engage you. But it's important that you pay attention for this one because it's really a key one. So what is it? It's the foundation on which your program is going to be built. I mean, this is what's really holding up your program. And it's so subtle and sometimes almost non-existent in terms of discussion points, but people tend to overlook it. And when they overlook it, they don't pay attention to it. When you don't pay attention to it, that's when your program is going to suffer. And I'm hopefully going to instill in you a sense that this is important, but also how to build infrastructure into your program and maintain it over time, because that's also a key piece as well. It really refers to all the people, process, and technology, as well as cultural elements that are required for a successful implementation, management, and sustainability of a program. Kind of a long-winded way of putting it, but it really is all of that. And we're going to talk about the people, process, technology, and culture in specifics. And we're going to go into what your program is going to need in each one of those categories. Making sure that you're checking the boxes on each one of these is going to be important because you don't want to miss too many of them. At least having some element of it within your program is going to be, I think, fundamental for success. So people, by far and away the most important, I would say. There's a lot of things that can play a role in terms of a program success, but man, without the people, it'll just flounder. And I think you have to have good leadership. I support a dyad model for your value analysis program. Typically, that's a physician lead who can be a medical director, but they don't have to necessarily have that title. But somebody who's a physician who's recognized, who's the leader of the value analysis program. I think it's important to also have a supply chain services lead. In my situation, I was in a dyad model with our VP of supply chain services. That was a very effective model. I think you have to have representation from nursing because they're going to be one of the clinical groups who are going to want to have input in the supply chain decision making, particularly with regards to value analysis. It's also good to have contracting representatives. So the people in contracts are going to know the vendors. I mean, they're the ones who are actually out there dealing with them on a daily basis because most of the time contracts get negotiated and signed without value analysis programs ever becoming aware of them. And that's a good thing. That's the way you really want it because it makes it a much more efficient process. Value analysis is really going to be reserved for those special situations where you really need to get input from subject matter expertise and really look at some of the evidence around the products that you're selecting for use in your organization. But the contracting representative, they're going to have some inside information on the vendors. They're going to know them. They negotiate with them on a regular basis. They know how they've performed in the past. They know the ones who are always trying to slip something by or somebody who's always asking for a price increase. And they know everything about their negotiating style. So they're good to have at the table because they can give you some insight into the vendors that you really don't get, particularly from most of the other people who are going to be part of your infrastructure. Data analyst. It's important to have data, and it's important to have somebody who understands how to abstract the data, that is, pull it out of the database, knows how to analyze it, knows how to interpret it, and knows how to present it. And so those are four functions of a data analyst. And the thing about it is what I found was sometimes you'll get a data analyst who's really good at number one and doesn't do the other three. So you've got to try to find somebody who can do as many of those as possible because if you don't, somebody else on the team is going to have to do it. So typically what will happen is that you'll find a data analyst who's really good at abstracting data, maybe even analyzing it, but interpreting it and making sense of it for the rest of the group may not always be in their wheelhouse. So you want to be able to have somebody who can do that. I was fortunate enough I had somebody who could do all four. It was really kind of nice to be able to be in that position. But I recognize not every organization is going to have that talent set available to them. So you want to be able to look for people who can contribute to all four of those items that you're going to need from your data analysts. A research analyst is similar. Now, other members of your team can do the research. It doesn't have to be a specific person. It's nice when it can be. We typically would have our nursing representatives who were doing that piece of it, so we didn't have to worry about the research, specific research analyst. Some value analysis programs, though, will have a specific person who's assigned to that. And there's nothing wrong with that. It's actually kind of nice. It's luxury if you can get it. So if you can get it, you should ask for it. And then you're also going to need multidisciplinary representatives. These are people who are going to be typically folks who are representing the medical staff or nursing staff within your organization. And if you're a single value analysis team that does all of the value analysis team projects, then you're probably going to want as many multidisciplinary representatives as you can, or at least people who can represent the various specialties. If not, if you're using value analysis teams to go do that outside of your committee, then you can have a much more limited number, and you probably want people who are in leadership positions, because these are going to be people who are going to be your ambassadors for your value analysis program. And then the last, and not the least, is the administrative assistant. You really want somebody who's going to do. Remember, the administrative assistant is going to be that person who's going to keep your agenda, set up your agenda, keep your minutes, store that information. They're going to reserve the room. They're going to set up the times. They're going to send out the invites. They're going to be doing all of that stuff that is really important for organizing these meetings. And my recommendation is if you can, find somebody who has medical staff services experience. And the reason is because medical staff services are really, really good at organizing physicians. People who never done that before typically flounder at it. Medical staff, as a general rule, usually don't always respond like you would, say, an employee in a corporation. So if you have a hospital and you've got a bunch of employees, you want to get together for a meeting, you send out an invite, people respond, and then they show up because it's part of their job. Well, for medical staff, it's not necessarily part of their job to show up at your meeting. So you have to have a way of getting them to respond to invites and also make sure that they're going to be there at those meetings. There's a whole number of tactics that medical staff services have learned over the years for doing that. So when you can, get somebody who has experience doing it. I had a meeting once that was set up by someone who didn't have that experience, and only one physician showed up. Needless to say, it wasn't a very productive meeting. And so we learned the hard way, and that is make sure we've got somebody in there who knows how to do that. I've often heard, trying to get physicians together is like, herding cats. And, what I've discovered is it just feels like it's like herding cats to people who don't know what they're doing. Medical staff services, they know what they're doing, and they can bring together physicians a whole lot easier, and it's not like herding cats for them. That's their job, and they know how to do it, and they're very good at it. Process. I think regular meetings is important. You should at least set up a meeting list for, I would say, a year in advance, and have it in the same place, at the same time, in the same room. Anytime you can keep that consistent, that's going to be really important. You should also have a call-in number, I think, because not everybody can make every meeting, but they will want to, or at least call in. Have the same number for the call-in meeting. If you do any type of WebEx or something like that, make sure it's the same process for getting into the WebEx, and make sure that your members know how to do that. That's going to be really important for keeping that periodicity into your meetings, because that develops engagement. Having a regular process, or regular meetings, is the way to do it. I also think having an agenda and meeting minutes is extremely important. Agendas tell, remember, that's forward-looking document. Meeting minutes are the backward-looking document. You have to have a way of communicating with your membership, and the way to do that is to have a really good agenda and a meeting minutes. And if you don't do that, I think you're putting yourself at a huge disadvantage. Established reporting structure. When we get into governance a little bit later, we'll talk about this under accountability, but you have to have an established reporting structure. Your committee has to be reporting to somebody, and they have to be built within the governance of your existing organization. Typically, that'll be part of your administrative governance, but that's, it kind of varies depending on the type of organization you're at. But I'll talk about that under accountability, but remember, that's part of your process. You have to be part of that reporting structure in order to be successful. It's the same thing for communication plan. Understand who your stakeholders are, understand how you're going to communicate with them, have a regular way of doing it. It's like with the newsletter. I put that out on a regular, came out the first Monday of every month. It's just, get in the habit of doing it, make it look the same, but make sure people know how to look through that in a very quick fashion to get to the information that they need so they don't feel like they're wasting their time. But they also know that if there's going to be something important, it's going to be in that newsletter and you're going to communicate it to them. And that's a really good way of, it's a really good process to have in place for making sure communication's occurring. Data review. It's important to understand how you're going to review your data. There's a certain way of doing it. Like I said, I always liked first starting to look at usage lists because I want to know who the physicians who are going to be impacted. And if we're going to be looking at value analysis, I want to know who's going to be the members of those teams. But it also is a way of getting into understanding data at a different level, beyond usage lists. You can start looking at pricing and looking at, hey, what if we work with this vendor instead of that vendor? Can we get better pricing? Data is going to be important for making decisions in this part of the program. So make sure you have a process for how you review data, make it fairly consistent, be reasonably flexible. We had a time when we were working with a cardiovascular group or a group of cardiovascular surgeons, and they came back with some recommendations about how to look at the data. That was very different than what we were doing. And so we incorporated that into our new process. And we said, hey, every time we look at this type of product category, we're going to need to look at it this way because that's what the cardiovascular surgeons are interested in looking at. And it's important to respect those things that they need to see or ways they need to see data because it helps them understand the data and the products better. And so by doing that, we're engaging them more. So if we said, no, we don't look at data that way, that's not the way we're going to do it. You just should look at the data the way we have it. Very disengaging. You're not going to get a whole lot of buy-in on that one. So listen to your stakeholders out there. They're generally, like I said, they're subject matter experts. They're going to have a much better view of this data than, in some ways, than the people who work with it on a daily basis. So listen to them and incorporate that into your process. I think goal setting is important. You have to have a process for setting your goals, and we'll talk about when we really get into performance improvement. You'll see I'm really big about metrics and being able to demonstrate progress over time, not just for projects, but for the program as a whole. Having a process around that, and I'll tell you, I'll show you one way to do this under performance improvement. But I think it's important for you to have whatever process you're going to use. Make sure it's consistent. Make sure everybody's aware of what that process is, and then workflow. How many times people would come back to me and say, how did that decision get made? It's always nice to be able to put something up there and have a workflow and say, this fell into this committee, they made this decision, or they developed this into a value analysis team, and there's a value analysis team's recommendation. And that's where we came up with the decision for that particular product category. Being able to demonstrate that through a consistent workflow and saying, that's the workflow we use every single time, people realize, okay, you've got a consistent process for doing this. Now that I know what that workflow is, I'll know if I need to get involved in it in a future basis. So it's important to communicate that to your stakeholders. So technology, you're going to need some inventory management system, and if you're in a hospital or healthcare system today, you probably have one, whether you realize it or not. But it's good to be familiar with it, understand what it is, understand how it works, and what its strengths and weaknesses are. Your supply chain services probably have a pretty good understanding of what its strengths and weaknesses are, so listen to them. They'll be able to point these things out. And not only that, but systems there's just an incredible amount of work that's been done in the software and inventory management these days. And so there's a lot of really cool systems out there, and they do some really amazing things. So be willing to look at it, be willing to understand it, because there's a lot of information that can be gleaned from these management systems, not just in terms of usage, but also ways of getting better information about the products that you're using. Electronic medical record, I think there's an advantage, obviously, for this in terms of value analysis. It can give you more consistent data coming out of your electronic medical record. The better you're going to be able to make decisions. Sometimes you can start to incorporate things that involves patient care or encounter level detail on outcomes, and now you can start looking at outcomes with your electronic medical record and combining that with the data you're getting from your inventory management system. It's really a cool way of being able to start to assess whether products are really giving you and your patients better outcomes versus what's claimed. Um, it's also nice to have a data system. We were fortunate enough, we had a lot of data silos, and we were built an enterprise data warehouse. A lot of hospitals are moving towards that. Healthcare systems definitely moving towards enterprise data warehouses. And basically what it is, it's just one repository. So if you have multiple sources of data, modern day hospitals will have, easily, a dozen or more, 20 or more different types of siloed data out there. What a data warehouse does is it pulls the data from all those different silos and puts them into one warehouse, and then it has one search function for how to pull that data out of that, or abstraction function. So it's really important to have something like that. If your organization has it, you find out if you don't have one, that's great. Or excuse me, if you don't have one, I'm sorry, but try to get one. If you do have one, find out who controls it and how to get access to the data in it, because it's going to be really important for developing decision-making tools for your value analysis program. I also am a big believer in risk adjustment and benchmarking capability, particularly when you're looking at quality, but also for costs as well. It's nice to know what everybody else is out there doing, and there's different ways to do it. One of them is with your own administrative databases, but we were a premier shop, so we would have them do our statistical analysis, but there's plenty of other programs out there. They'll do the risk adjustment for you and benchmarking when you want to look at outcomes. But it's also important to look at other types of organizations that provide benchmarking capability in terms of pricing. And I talked about that with the True Car example. You go out there and you find an organization that is doing that for supply chain management and healthcare. And that's a great resource to have. So tap into that. I also think that centralized storage for documents is important. We talked about the meeting minutes and the agenda and things like that. There's a lot of other documents that get developed over time, decision-making trees for various types of value analysis teams and things like that, or maybe even the evidence, somebody brings in papers. You want to store it somewhere, and you want your members to have 24/7 access to that storage. So having some type of SharePoint or some other type of cloud-based storage device so that people can go in there. They travel, they do things, they can't always look at things, on your time, and so you want them to be able to look at it on their time. That way it keeps them informed, keeps them engaged, right? So it's nice to have centralized storage. Plus, if anybody leaves the program, everybody knows where the documents are. There's no, whose laptop is it on this week, none of that kind of stuff. If you lose your administrative assistant, they put it in one place, and the next administrative assistant just jumps in and starts just from where the other one left off. You don't have to worry about that transferring of documents from one device to another. I'm also a big believer in teleconferencing capability, and this could be as simple as a telephone with a speaker. That's it doesn't have to be anything really fancy. Just it could be your cell phone on speaker mode, because you want people to be able to call in and feel like they have some say and they can hear what's happening at these meetings. Not everybody can be at every single meeting. We were an organization, we were spread out over 7 states. And so it was impossible for everybody to be at every meeting. So we had great teleconferencing capability. We would also be able to set it up on the internet so people can watch what we were talking about and see the documents that we're looking at in our meetings via teleconferencing. So it's nice to have that capability. If you don't have it, just go to the old standby, the cell phone with a speaker mode, and that works just as well in many instances. But set up something and make sure it's consistent, make sure people know how to use it too. So culture, this is an important one. If you have a quality improvement program, most people have a quality department, but if you've got a program and they're specifically doing projects that involve value analysis, you're way ahead of the game. The number of people out there who are doing that is very few and far between. So if you're doing it, you're there. Your culture is already one that's demonstrating interest in that area, and so you should take advantage of that. Don't be shy about calling your quality folks. Now they may just say, "Look, we're too busy. We're not getting involved in value analysis, or we're not going to help you with supply chain stuff." And that happens from time to time. I had that happen to me when I was told you about that earlier about the whole reprocessing program, and it went to our quality folks and our patient safety and said, "I need some information on defect rates," and they said, "We don't do that," and that was just the answer they had. But fortunately, I was able to find the information at another part of the organization. So it doesn't hurt to ask. The other thing, recognition awards. So just ask around. What do we do we have any of these things? Like for Truven or Baldrige, or if you're fortunate enough to have like a Baldrige award or something. But There's other ones out there, particularly with regards to supply chain. So Gartner, ECRI, these are some of the organizations out there that are heavily involved in supply chain, particularly the healthcare sector. And so they give out awards for being, the top, whatever, 25 hospital or whatever. And it's important to know that, because what does it do? It sends you and your organization a very important message. We think this is important enough that others are recognizing us for it. And you want to be able to say that, hey, that tells us something about the culture that we're in. If you have none of those awards, any kind of quality improvement program, you might want to start asking yourself, how do we do that? How do we develop that culture for that? The other one is the value analysis supportive environment, which to me is really sort of that's the one that's the single most important one. If you go to your senior management and tell them that you're working on a value analysis program and they say, what's that? You got a problem. They have to know what your value analysis program is. They have to know what its goals are. They have to be completely supportive of it. And when we get into accountability, you're going to see how you can do that, how you can build that into your program from the very start. And so value analysis supportive environment is going to be, I think, a very key part of your infrastructure, because that's where you're going to get your support. And if the times get hard and you need to lean on your administration for something, for some resources to help you promote the program, you want them to be on your side from the very beginning. And I'll teach you how to do that a little bit down the road when we get to accountability. But it's important to build that culture. And it really comes from performance improvement and having a culture that continuously improves over time. And when people start to see that, they start to accept it and understand it. And now you have a culture that's really going to be, I think, energizing your value analysis program. So if you don't have one, think about building one. And if you do have one, thank your stars, because it's a huge advantage to encouraging and growing your program. So as always, any questions, feel free to contact me on my email or my website. And we will now move on to the next section. So thank you very much and have a great day.